Coming to you from Philadelphia, and I'm so excited to be chatting with PESI today and with PESI's audience. I've done this before as a presenter for PESI, but now I get to do this as an author, and I'm so honored to be in that position and to talk with you about my new book, The Perinatal Patient. I wrote The Perinatal Patient with my mentor, Karen Kleiman, who I'll talk about in a second. And Karen has been an expert in the field of perinatal mood and anxiety disorders for 30 plus years, a thought leader in the field. And I have the fortune and the honor of being her mentee. So together we wrote this book, which is new for her body of written work because it's a workbook. We long time ago started to talk about what it would be like to create a really sort of interactive, easy to access, but full of like good concrete material workbook for providers instead of for patients. We see that there are a lot of different resources for moms, parents, dads, support people to help them recover through postpartum depression, postpartum anxiety, postpartum OCD, and other mood disorders. But there really wasn't a guide for practitioners. And what we have found in Karen's 30 plus years of work, in my 10 plus years of work in this niche of our field, is that providers really want tools to be able to help new parents, what we call speak their secrets or share their sort of private distress. We know that perinatal mood and anxiety disorders affect many, 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 many parents. 1 in 5 moms, 1 in 10 dads. Very, very common to experience a mood disorder after the birth of a child or after welcoming a child into your family, regardless of whether you've given birth or not. But what we also know is that by and large, parents don't receive the help that they need from their providers. And what we hear from providers is people who've been doing trainings and lecturing on this topic for so long, is that providers don't know what questions to ask. They see a parent who sort of looks like they're doing well, or even the parent will say, yeah, I'm doing okay, and my baby's doing well, and I'm, having a little bit of sleeplessness, maybe I'm feeling a little emotional, but everything's okay. And what we're hearing from providers is they don't know how to dive any deeper than that with their patients. And so what we hear from patients are, my provider didn't ask, or I didn't know if it was okay to share. And so we wrote The Perinatal Patient to give, to put in the hands of providers all of the tools that they could possibly need to begin interacting with their patients in a way that will allow them to sort of speak the language of the perinatal parent, the perinatal patient. So in the book, we cover kind of the range of what's typical to be expected and what's outside the range of typical. So, for example, we know that all new parents feel emotional. We know that all new parents will have an increase in anxiety. We know that all new parents will be sleepless and sleep deprived. But not all new parents cry as a symptom of depression. Not all new parents worry as a symptom of generalized anxiety disorder. Not all new parents experience sleeplessness as a result of another mood symptom or disorder that's brewing. And so what we need to be able to do as providers, and not only we as counselors and therapists and social workers, but all providers that interact with new parents, what we need to be able to do is say, yes, a certain amount of this is typical and to be expected. But if you're experiencing more of it than is typical or baseline for you at this time, we have to really have that looked at. And so how do we have those conversations with our patients? What do we look at? What kinds of questions do we ask, and what do we say in order to help our patients really engage with us in a conversation? Remember, a lot of times new parents, because they are new, haven't experienced what it's like to feel emotional in the postpartum period before, or in the late stages of pregnancy, or even the early stages of pregnancy. So when we're having these conversations with new parents, if we don't know what questions to ask, they may not know what information we need. And so again, one of the really important skills that we teach in training and that we tried to really kind of fill this book with is how do you do this? How do you engage with patients so that they feel safe and comfortable opening up with the questions that they have, talking about the symptoms that they may be having. And if you are a therapist or if you are a provider who's in a position to treat patients with some of these mood and anxiety disorders, then what do we do? What's best practice for the different mood and anxiety disorders? How do we support new parents who might be struggling with subclinical symptoms? And if parents are having clinically very relevant symptoms of full-blown mood and anxiety disorders, what do we do? How do we overlap the treatment for the perinatal mood and anxiety disorder with parents who need support, people who have infants to take care of? An example that I give really often to providers that are treating perinatal mood and anxiety disorders is around panic. So as therapists, most of us have some training or familiarity with how to help people work through symptoms of panic. But if you're someone who's having panic disorder or has a panic attack and you have a little baby and you're maybe breastfeeding, well, if you're someone who might consider medication outside of the perinatal period, that patient may not know that medication could be used in the perinatal period or may not want to use medication in the perinatal period to assist with panic. That person may not have the ability to ground themselves and to practice breathing exercises because they have an infant over across the room. They may be home taking care of an infant and healing from a C-section, healing from birth trauma, physically to their bodies or emotionally. So when we think about even just the details of treatment for mood disorders that present in the perinatal period, it's really important that we as providers come with resources that are actually usable by new parents. And so again, one of the reasons that we wrote this book is to try to bridge that gap. And we know that, the majority of therapists, the majority of people who interact with new parents out there don't consider themselves specialists in perinatal mood or anxiety disorders and may not be interested in becoming specialists. We also know that most of the people, that most of the patients that a therapist, a social worker, any treater will see are people who have children at some point in their lives. And they're definitely people who've navigated a reproductive story, because as human beings, we all have a reproductive story about what parts we have, what parts we use, how we use them, how they've produced for us. Do we choose to become parents? Do we choose not to become parents? Are we not parents by not our own choice? So this book is really aimed to help providers understand the nuances of what people experience at this stage of life, and also to be able to open up these conversations. So now that I've given my bit of information, and hopefully, if nothing else, conveyed my passion for this project, I truly, I tried to write the book that I wish that I had had when I started working in this field. And if I had kind of all of the clinical pearls that I've collected from all of the thought leaders that I've had the opportunity to work with and learn from, I tried to put it all in one place. So if there are questions, I'd be so happy to take them and answer them at this point. Let's see. Okay. How do you see the future of postpartum care evolving? And are there any areas where more research or attention is needed? There are a million areas where more research and attention is needed. Like so many issues, we are, in my opinion, under-researching perinatal mood and anxiety disorders. And I would love to advocate for more and more focus on best practices for treatment, best practices for training for providers, understanding the etiology of perinatal mood and anxiety disorders in more depth, and particularly in non-birthing parents. We pay a lot of attention to the experience of the birthing cisgender mom, and we know that that's not the only person who's in our community and our cultures that is impacted by perinatal mood and anxiety disorders. Birthing parents, non-birthing parents, cis parents, all parents are affected by the risk factors for perinatal mood and anxiety disorders. And so we really, really, really need to be focusing a lot of our attention on understanding where these mood disorders come from, how we best treat them, and how we offer support, not only that can alleviate symptoms in the now for the benefit of the new parent and the benefit of their baby, but in the long term. Because think about what happens when we become parents, right? We take on this huge new responsibility, which is impactful and intimate in a way that we may not have experienced before in our lives. And if we are struggling with self-esteem and self-confidence around this really important task, that, when it's not resolved, will impact us over the next decades of our lives. It will always have an impact on how we think about ourselves as parents to our children, as human beings in our world. And so to really understand the psychology of this stage in life is not only a gift to the new parent and to their baby, but to that person and that family in the long term. My hope for the future of postpartum care, quite honestly, is that we will start to really, really normalize help seeking in this stage of life. If I had sort of a magic wand and can make one wish come true, I would provide mental health care and mental health assessment to every single new parent, regardless of whether they've given birth or not, how they have created their family. Because we've done, at least in the United States, we have done a better job normalizing that postpartum depression and anxiety exists, is common, and that there are treaters that can help. What we have done less of a good job doing is really normalizing help seeking, really normalizing that if someone's not sure if they feel okay or not okay, if someone's not sure if I'm crying too much, we need to be normalizing reaching out to a mental health care professional and or a provider who can give some clarity on that. So I hope that a change that's coming will be that that standard mental health care becomes part of all prenatal and postpartum care. Any other questions? I think I probably have time for one or two more. How can a practitioner help a postpartum woman in distress feel more comfortable disclosing her symptoms? If there is kind of one magic trick statement that I could give, and again, in the book, we've tried to really script all of this. Postpartum women in distress really benefit from a combination of conveying safety in the space, which we do with our body language, right? We open up, we lean forward, we make eye contact, right? If we're a provider who uses a computer, we turn away from the computer toward our patient and we make eye contact with them and say, how have you been feeling? Asking with concern, right? Asking with the expectation, conveying the expectation that maybe that person, our patient, has something that they need to tell us, as opposed to setting them up to say, oh, well, everything's going okay, right? Making eye contact, leaning forward, showing that we care. And offering, regardless of what mom says in response, regardless of what your patient says in response, offering the guidance. If you're not feeling well now or at some point in the future, here's a resource that you can access that will help give you clarity on whether additional support is needed. No matter what a new parent tells me, when a new parent says, I'm doing amazing and I love my baby and I'm sleeping 8 hours at night already and everything is just hunky-dory, butterflies and rainbows, I will always say to them, parenting is really, really hard. And if that changes at any point, please talk to a healthcare professional or reach out to someone like me who's eager to help along with that journey. So what we can do as practitioners, whether you are the OBGYN, whether you're a doula, whether you're a midwife, a lactation consultant, a nurse educator, a peer support, please let new parents know that that help is available and that you don't need to even know whether there's something really wrong to access help and support. As maternal and parental health care providers, we're really, really eager to help parents sort out what's normal for them and what's outside of normal, and to make sure that parents know that that recovery from mood and anxiety disorders is a very real possibility. We find that these disorders are very, very treatable. And so the goal of this new book, The Perinatal Patient, is really to help providers help parents bridge the gap from how do we interface with our patients for just a few minutes sometimes in our offices and then help them access care. So I think the last thing that I'd like to say, I'm just checking my time. I think the last thing I'd like to say before we wrap up is that in response to that previous question, keep in mind too that new parents don't have a ton of bandwidth at this time in their lives. And so lots of times when we give a brochure or a flyer, a handout, something like that, it will get lost in the diaper bag, under the car seat. It may not get looked at again. So one of the tools, again, that we really hope to offer through this book is the ability to put some really solid psychoeducation in parents' hands. And so giving me, using this book to be able to say, we just talked about topic X, here's a handout, fill it out, read it. it's completed for you as an example. It can be interactive. It can be for point of discussion. We really tried with this book to create tools that will be accessible for providers to give to their patients, for patients to really use, all written with sensitivity to what's happening in this stage of life. So I really genuinely, sincerely hope that that you'll consider looking at the book, and that it will be a resource that can be very helpful to you and to your patients, and most importantly to the parents that need so badly need support in this very complicated world that we're living in. So thank you so much for tuning in today. Thank you so much for following my work and our book. And I look forward to your feedback